of this session for the benefit of those who are not yet here with us. And good evening, good afternoon, good morning, depending on where you're joining us from. It's 6 p.m. Geneva time, and we are starting with our 12 daily lightning session today, the 18th of August, 2020. And it's always a pleasure for Shalini, myself, and the rest of the scholar team to have you here with us. I also see there's Joshua Ienyomi that's still joining us from Nigeria. You're welcome. And please, as you type in your messages, ensure that you're typing to all panelists and attendees. All panelists and attendees, and not just to the panelists as you have done. Ada Khan that's joining us from Kenya. So you're welcome. And thank you to Dr. Tanushree. It's always a pleasure to have you in this session. So actually, where are we? We are in the ultimate week, the week in which you submit your project. And where do you submit your project? You submit your project on PeerGrade. PeerGrade is a platform where you submit your project so that it can be reviewed by the peers. It can be reviewed by your peers. They can comment, they can grade you, and they can give you useful advice on how you can make your work better. The tutorials on how to join PeerGrade, how to submit your project, all of those are available on the Learning.Foundation platform, and you'll get some a very detailed video tutorial from Zah, and even the instructions below the tutorial on how you do join. So I have a question for you. How are you doing with your project? At what level are you? Just remember that we have up to Friday this week, Friday midnight of this week, that's the 21st of August, midnight Geneva time, to submit our project. If it's going to be midnight in Geneva, it is 11 p.m. In Cameroon, 11 p.m. in Nigeria, it should be 10 p.m. in Ghana. So depending on where you are, but we know that the time for submission is latest 11 p.m. Geneva time. So please, just want to invite you to continue to work on your project. It's very important. And we are actually in week two of the exercise 1, which is to submit the initial version of your project. And what you have to focus on is the actions that you carry out to achieve your goal. How will you turn this project into action? And you may need to search the ideas engine for useful ideas. There were some very useful ideas that were posted on the ideas engine that could help you to improve upon your project. So please, I just invite you to go ahead, go to the ideas engine. It's not an obligation, of course, so, but I think you'll get some very useful ideas in the ideas engine, but it's also very important to be concise and practical. Make it easy to understand, just be straightforward, in the way. And what are we using to do that? We have the template. We have the template that has been prepared. That is the only document. All you need to do for your project is to fill in the blanks on this page, to fill in this document step by step. At the end of the day, it's a template that has been prepared for you. It's a Word document, a Word version. You can download it on the Learn.Foundation platform. You may want to know your country. Now, the technicalities of PeerGrade and every other thing, I'll just want to refer you to the technical support sessions with Dr. Alain Blaise Tatinku every Tuesdays to Friday, 11 a.m. Geneva time. So I'd just like to propose that you ensure that you visit those sessions. And thank you to Yahya Ahmed for allowing us to give you the support. We are here for you, and we are a team. We are together. Usually it's better in French. In French, they say on est ensemble. English, we say we are together. So we are together, and we are together to ensure that you get all the support you need until the final stage, the week 4 of this exercise. And welcome to you, Mercy Ono Peters. This is the third Mercy that we're having in the room today from Nigeria. I think that should be Abuja, Nigeria still. You're welcome to this session. And as I was saying, you fill in the information. That is, if you want to know your country, you don't need to put in your name, where you work, your level in the system, and all the other stuff. Then you talk about your challenge. What is your priority challenge? Why is it a priority? And then you set a specific goal that you want to attain. Be as specific as possible. And then you want to take action. What actions can you take to overcome that challenge? That is on the right side where it's specific action, you write down the action. In the detail, you may list a list of tasks. So here I'm just reporting, I'm sharing the useful advice from Dr. Francois. Guys, you list, that is the task that you may take to actually achieve, to actually carry out that action. And then you have the part that has to do with the resources that you use. If you use the ideas from the idea engine, we may want to give honor to whom honor is due. So you may want to share the person that is the idea that you took, the idea number and the name of the author. I don't want to take so much time. We are actually 6 minutes gone. These sessions are more for you to do the talking. So we are going to go straight to the participant presentations. And just to say, if it's possible for you to share your screen, we'll be delighted for you to share your screen. But I'm also going to share this question, just paste these questions on the chat so you can, while the colleagues are sharing, the peer is sharing their screen to answer the questions, you may also want to attempt these questions on the chat, and I'll be delighted to read them out and to give you feedback, for you to get feedback from Shalini and the other scholars that are in the room. So I've just pasted the questions on the chat. So right now, I'm going to invite you to raise your hand if you want to attempt answers to these questions. And we have a very important guest that I just I invited I had just a few minutes before the session to join the panel. That is Hanatu Janada Dimas from Abuja in Nigeria. I invited her to join the panel. So she's co-panelist today with Shalini and myself, and she wanted to talk to us about her project. I'm just going to invite Hanatu. You unmute yourself, and I'm going to stop sharing my screen so that you will have the possibility of sharing yours. And once again, I'll paste the questions on the chat for those who are in the room who want to answer the questions on the chat. So good evening to you once again, Hanatu.
Good evening. Can you hear me?
Yes, we can get you 5 on 5. So okay. Can you just introduce yourself and tell us where you work?
Okay, so my name is Hanatu Janada Dimas. I'm a physician and then a field epidemiologist. I work presently with the Nigeria Security and Civil Defense Corps, which is a paramilitary outfit in Nigeria, with some kind of focus to disaster management. We have a health center, although for immunization, generally I work as a supervisor at the national level, but for my own center, we just started immunizations last year. So like it's still in the formative stage for this particular center. And this is where I'm going to focus on for my presentation.
All right, so thank you. Do you have the possibility to share your screen with us?
I'm trying to see that I do select.
There is a green button at the bottom of your screen.
Yes.
That's share screen. So you click on that button.
Okay.
Yeah, so when you click on the button, voila.
Is it shared now?
Anyway, it's coming through. Yes, it's shared now, so we can see your screen.
Okay, all right. So just as I told you earlier, I'm just working on it. I'm not done with it, but at least let me present what I have so far.
Thank you.
So the topic here I have is sensitization of target population on the need to continue routine immunization in the face of the ongoing COVID-19 pandemic. I think my topic is kind of long, but let me leave that to review by the other peer hub members. My country is Nigeria. I've not put my address yet on the GPS coordinate. I'll get that. And then for level, national stroke base, then the challenge is the district decrease uptake of immunization due to COVID-19. Then my goal is to increase the uptake of immunization at my center. So here I have a brief introduction about the center. So it's not a typical primary health care center that the communities are used to. It's a new center which For some people still feel it's mainly for the personnel because it is situated in the headquarters of the NSCDC, which is a paramilitary outfit. So most of the surrounding villages and communities still think it is only for the personnel. So that way, that is affecting us too. So in 2019, some of our personnel were trained by the state, which is the FCT, on the new guidelines for routine immunization in Nigeria. And not long after that, we were able to commence immunization in the center. Basically, we've had gradually increasing clientele. That is from the onset till March 2020, when when we had the first case of COVID-19 reported in Nigeria. About a month after that, we had a case in the center, which was who was admitted, being managed, and then later confirmed to be a COVID-19 positive patient. So this led to the shutting down of the center for a while, just to decontaminate and to arrange for proper implementation of infection prevention and control measures. That's by personnel in the center, to be sure that everybody is well kitted, just in case you come across such a patient again. Communities around the vicinity got to know about the situation, of course, and that affected their coming into the center to access our services. They got worried about their safety when they come to the center, and that led to a decline in the approach of the center for all services, including routine immunization. Now, the reduction in immunization, this caused a reduction in immunization uptake in the center. Meanwhile, we were still in the process of building up the clientele, so this brought about a decline in our output generally. Furthermore, some of the clients blamed the general lockdown because there was no movement. There was a general lockdown in the city, movement restrictions, and most people that would only be able to move with public transport were unable to do so because public transport was kind of not visible at all. So if you had your private vehicle, fine, but if you didn't have one, it was much more difficult. So that also reduced the tendency for them to actually come to access immunization in our center. So the particular goal that I have is to increase the demand of immunization and decrease the incidence of vaccine preventable diseases amongst children in surrounding communities. Our focus will be on the communities around the center with the assistance of community leaders. So because the center is situated in the headquarters, just as I said, it is not really in the vicinity. Unless you come into the compound, you may not know that there's a health center there, so you might not even try to access any services there. So coming into the center would actually entail making a deliberate effort for them to get into the center, which is a bit far from the express, which is just by the airport road here in Abuja. The clients now, both old and new, may need to get a push for them to be willing to come to the center for immunization because of all these factors that I have stated. So with adequate sensitization, we would expect that more caregivers will understand the importance of immunization, thereby giving rise to an increase in demand, which will lead to an increase in the uptake of immunization by members of the surrounding communities. So for the action, as I said earlier, I don't really have, I've not penciled it down, but I don't know if I could just discuss.
Yes, please go ahead.
Okay, so we want to do some community engagement by reaching out to the community leaders to get their buy-in and for us to explain the situation to them and get them to assist us with what we want to achieve. And our main focus would actually be COVID-19 sensitization. We'll intend to go out for COVID-19 sensitization, risk communication in these communities, and then would use the opportunity to tell them more about immunization, to explain to them the need for them to continue their immunizations, and even because of the pandemic and We might even get to discuss some of the data that we have, and research papers are relating a lower number of cases in places where BCG is high and all that. So we'll try and use all that to convince them and to sensitize them and to help them to see reason why they should actually access immunization. They may have other places that go for immunization, but of course, would also try to explain to them advantages of them coming to our center. I don't have much written down. I think I would drop the mic here. I don't know if there are any questions or comments on my presentation. Thank you.
Thank you very much, Hanatu, for this wonderful presentation. And yes, I know you're not yet complete, but you already have enough material, and you've given sufficient detail to justify number one, the challenge you're facing, and two, the goal that you have set for yourself. So now I'm going to invite Shalini to unmute herself. Shalini, you have listened to Hanatu present. What do you think? What are your thoughts? Do you have any other questions, further questions to ask her? And then I'll also invite you, you are in the room, you have any thoughts about her presentation or any questions, please, you can either raise your hand or type in your questions on the chat. Over to you, Shalini.
Thank you, Charlotte, and thank you, Hanatu, for the wonderful presentation. So my question to you would be, you said that there is zero uptake of immunization for several weeks, right? So yeah. It would be good if you could present some data to show how there was a decline, if you have access to it. And it would be nice to show, you know, that at the beginning of the year, you know, the immunization, or if you feel that it's appropriate, then you could show the data maybe from last year around the same time, what the coverage used to look like to what it came to. And I know you said that the center is new, so people were not aware about the fact that it was just not for the paramedic, military people. But having said that, I feel that your goal is pretty specific. And I think, as Charlotte said, you described what your focus is going to be like. Which also sounds very concise. If you could just scroll down and show me the actions again. So I had a few questions regarding the actions. I know you haven't completed them, but what you could think about is, you said that you would reach out to the community leaders to get buy-in to increase RI uptake. So my question is, have you thought of how you would do that? And how you would engage with them, what the process would look like, and how many times you think you would need to have meetings to get their buy-in. Then my second question is, if you're doing community sensitization, what would the mode be? Would you, how would you reach out to the communities? And my third question is around town halls. Again, you were saying that you would reach out to community leaders and would engage in risk communication. Are there already material or resources that have been developed? If not, how long do you think the timeline would be? So these were the things that I would encourage you to think about, and it would be great if you have thought about these. Thank you. Over to you, Hanatu.
Okay.
All right, Hanatu, please go ahead.
Okay, so yes, for data, actually where I said zero uptake for several weeks, I have data. I'm trying to summarize what we have in the center now, and when I get it out, definitely I'm sure of the zero uptake, because for some time there were no plans at all for immunization, but I'll get the data out and I'll summarize it and I'll attach it to my work. Then for the process that we intend to use, reaching out to community leaders, we're going to So we have 3 communities in mind. So for those 3 communities, we're going to have one-on-one meetings with the community leaders and explain some of these things, have a meeting with their council, because they usually have council of chiefs, probably the heads of the clans that are in the village, representatives there and all that, would get to talk to them and just explain things to them, and would see, based on our interaction, would now know what else that would need to do. Then for the community sensitization, just as we have representatives of the clans, we wouldn't be able to hold a general meeting that would actually pull too much of a crowd because of the COVID-19 situation. So we're going to talk with their leaders, maybe the youth leaders, the women leaders, to see if we could get representatives of people that have some kind of influence in their communities. So we'd want to engage with them. And then for the risk communication, we're developing some materials right away. We're already working on them, and once we get those materials ready, we're going to use it during the risk communication engagement meetings in the communities. Thank you.
So thank you very much, Hanatu. Yes, Shalini, please go ahead.
Just one comment, short comment. So Hanatu, that's really great. Just another tip that I would say that you could add in here is the timelines and what frequency you think that you would need to engage with the community leaders, and how you think you would measure your impact. If you could, you know, think through, and even if it's short term, but you could present that in your project, initial project as well, and, you know, get some timelines and stuff, because you were quite clear on how you're going to do it. That would be great.
Okay.
So thank you very much.
Thank you.
Okay. Thank you to Shalini. And it's like you, either Martha read your mind or you read Martha's mind, because Martha just typed in the chat, good attempt, Hanatu. I also suggest setting your timeline and also monitoring progress will be good. That's just echoing what Shalini just shared. And one thing I also wanted to add, Hanatu, is really all the detail that you have highlighted concerning reaching out to the community leaders, concerning preparing the material for sensitization. Those are all tasks that you need to clearly, point by point, spell them out in the details. So here I am sharing advice from Francois Gas, who is not, unfortunately, is not with us this evening, but this is the advice that he will want to give you, that for each, like, and then it's good to use action verbs. Like for specific action, maybe instead of saying community engagement, you can talk about increasing or activating. I don't know, use an action verb, community engagement, organizing, sensitization, outreach, you know, that is organize or not organizing. So use some action words and then add all of that to the feedback you have received from Shalini and Martha and others in the chat, and then you have a very good project. Really, thank you for taking up on my offer to present your work, even though you were not sure. But I think it was a very good attempt, and you are on the right track. So thank you. I just wish you all the best with the rest of the project.
Thank you.
All right. So I am not seeing any questions in the Q&A. I am not seeing any hands raised on the chat. So Hanatu, please kindly stop sharing your screen so that I can get back to the questions. Okay, thank you. I see a question here from Eda Khan, who says, that's from Kenya, that says, is there minimum number of words or pages as we write our project? No, Ada, there are no minimum number of words or number of pages. We just think that it's important to be precise, to be concise, to be specific, but not to leave out any of the information. So my advice is you follow the rubric. The rubric is quite clear, and even the template in which the template in which you have to fill in your project, everything is so clear. And thanks, Shalini, for sharing the links on the chat. So it's a response to a question from Saidu that said, how should he upload his project, where and how should he do that? So thank you, Shalini, for sharing the links on the chat. So all the tutorials are there on learning those foundations, Saidu, and I hope that they'll be helpful and useful to you. So we need another volunteer who want to, even if you can't share your screen, you may just want to present. I see there's a question from Tijani Babagana that says, so my question is, during our community sensitization, is the priorities are area, social distance, or avoid panic? I really don't understand the question. You may want to raise your hand, Tijani, to ask that question. And Saidu Dairu says, lack of participation from the community might go. Okay, he's trying to answer the question. So Saidu, please just continue to answer the questions on the chat, and I'll read them in a short while. So we have the hand raised. Mercy Onu Peters is the only hand that is raised. So Mercy, I'll invite you. I'm sure you were presenting the other day and the internet connection disturbed us from getting you clearly. So it will be a delight for us to hear you this evening. Evening, Mercy.
Yeah, good evening.
And how are you today?
I'm good, and you?
Fine. So please, are you able to share your screen with us?
No, that is why I want you to do it for me. I can do my presentation.
Okay, just go ahead and do your presentation, please.
Okay.
Mm-hmm.
Good evening, all.
Evening.
Okay, I'm Mercy Onu Peters, MSc National Primary Healthcare Development in Jesse, Abuja. But my challenge will be on poor immunization coverage. And the topic I choose is reversal of the non-compliance of Oran LGA citizens to polio vaccination during COVID-19 pandemic. I will start by justifying my project by, according to available data, there was a reduction of the response of citizens to routine polio immunization across the community of Oran. Oran is in Akwa Ibom and is a local government. During COVID-19 pandemic, the recorded non-compliance may be traced to lack of health workers, fear of getting infected, conspiracy theory, poor supply of vaccines and personal protective equipment for health workers. As a result, many children are not immunized against polio, thereby subjecting the community into risk of polio outbreak in future. My project seeks to address the challenge and maintain and improve immunization coverage despite the COVID-19 pandemic. By my specific goals will be on stakeholder engagement, to educate the health workers, 3, to encourage the caregivers, 4, by immunization of the children against polio. In details of stakeholder engagement, liaising with the local government care teams, health worker teams, to ensure that immunization staff comply fully to the infection prevention and control measures against COVID-19 through adequate provision of personal protective equipment. And I have discussed with the LGA, which is the LGA immunization officer, which is the LIO, the benefit of my project, and he appreciated my effort. Also, there is need to engage community and church leaders on the importance of polio immunization during COVID-19 and urgent needed for their involvement to champion the cause I am about to talk about. 2, to educate the health workers, to educate them on the appropriate use of PPE to maintain good vaccination. 3, to encourage the caregivers. By doing that, by sensitizing the caregiver of the need and importance of vaccine, especially this OPV, to avoid the risk of outbreak, to educate and encourage the women through one-on-one visit, compound meeting or group meeting, call, social network, and community activities or flag off. For immunization of the children against polio, immunization of the children will take place at different locations. Like in that oral LGA, we have a lot of location hard to reach areas like riverine area. So we have to use the health community, the health workers to help them go to the community to immunize them. So my how to measure my progress is by collecting data, fresh data from the immunization units to compare if there is change after my project intervention. That was what I have.
All right, so thank you very much, Mercy, and that's quite interesting. I'm seeing the raised hand of Tijani Babagana. So I'll just ask you to unmute yourself, Tijani. We are going to, I just hope, since while you're unmuting yourself, I'll invite Shalini to say, so that you won't forget Shalini, or maybe since Mercy did not project. So please just go ahead, your comments, your feedback.
Hello.
Mercy, sorry, I mean, I couldn't hear you very well. So your priority challenge was, I couldn't get, could you just quickly tell me what your priority challenge was? I heard the rest. Yeah.
Okay, my priority challenge is to increase poor immunization coverage.
To increase immunization coverage, okay.
Yes, to increase.
Right. So what you said was you would be focusing on 3 actions, and one is infection control and prevention. The second you said was stakeholder engagement, and the third you said was community sensitization and awareness so that the uptake increases. Am I correct?
Yes.
So my question to you is, how are you going to achieve the 3? You were saying that you were going to measure it with data, but what are the steps that you are going to take so that you can showcase the impact? And given to the fact that COVID is ongoing and there is an immediate need, and therefore, you know, you need to think about, say, short-term actions which will yield positive results. So the first is, who are the stakeholders that you are going to engage with? And what is it that you're going to propose? I think you were talking about PPEs, but have you done an analysis of how many PPEs you would require if you're thinking about the health workers? And is there really a problem, or are they reluctant to provide the services for immunization is my first thought. So have you done any analysis on that?
Yes.
Sorry?
Yes.
Yes. So if you've done an analysis on that, it will be great if you could include that in your project and mention about, and what is the specific area that you're talking about? Is it your health facility, or is it the entire district? Is it, I didn't quite catch that.
Okay, the facility and the facility in the LGA, the local government area, the district.
All right, great.
Yes.
And so you know which your catchment area is, right?
Yes.
So the things that you need to think about are, who are the ones who need the PPE? The second is, what about the sessions? Are they still ongoing? Is there data to show that there has been a decline? How would you showcase that? Then if you do the stakeholder engagement, whom are you going to engage with? Can you just tell us what you've thought of? Who would these people be?
Okay, the people I'm going to engage, like the church leaders and the community leaders, the people that they look up to in the village, in the community areas, people that can tell them this is the reason why they need to go to the facility to take vaccination, especially polio vaccination, to avoid future outbreak.
Great.
To
how would
sensitize the
you do
women.
that?
The community, they have a lot of elders they look up to, community leaders, the church leaders. At least if information there, if information if there is a gap of information to the caregivers, at least when they get to the church, they will hear information. Maybe the announcement from the church will be able to make them go to the facility to tell them COVID-19, if you can prevent yourself and all that, you can also go to the facility to take vaccination by using their mask, maintaining social distancing, washing of hands, and using sanitizer. So some of them, because of the rumor, they are scared of doing that. And most of the health workers, they don't want to do that because they are not they very highly equipped by they don't have personal protective equipment. So I will educate them of using it. By doing that, I think we can achieve good vaccination.
Right. Now my question is, how will you reach them? Are you thinking that there will be people going out to the villages, or is it going to be via phone or the internet? Have you thought through?
Yes.
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 So,
because I have made a call through to them through the LIO, which is the government immunization officer, by reaching each of the community leaders.
Right. And for community sensitization.
Through phone call. Can you hear?
Yes.
Yes.
So
through phone call.
Through phone calls, right. And you should also think about the frequency at which you will be reaching out to them, because by doing it once, it might not have the results you were looking for. So how many months do you think you would require to get, to follow up with them? That's one. And the third thing is about community sensitization. So is this
once in a week?
Once in a week, fantastic. And is this going to be the community sensitization going to be through the thought leaders and the religious leaders in a cascade manner, or are you thinking about some health volunteers or personnel going into the villages and doing this sort of sensitization? Percy?
Please come again. I didn't really get that. The network is breaking.
Right. Sorry. So I'll keep it short. What I was saying was, have you, for the third action, that is community sensitization, are you going to use the thought leaders and the influencers for sensitizing the community, or are you planning for some personnel from the health facility to go to the villages and conduct the community sensitization?
Yes, with the help of the health workers and the community leaders, we're going to achieve that.
And do you have any material that you're going to use for community sensitization? Have you thought of where you would get the resources from, or would the government fund you?
The LGA has provided masks for them and hand sanitizer for them.
Okay. And the material to educate or sensitize the people?
Yeah. Yes.
Any standardized material that would be required, like an IEC material or an IPC material. So these are a few things that I can think of that you could, include in your project and you could think through. So thank you very much for describing your project very well, and all the best. Over to you, Charlotte.
Thank you, Mercy. Thank you, Shalini. And if there was one thing I was going to add is just to first of all, thank you, Mercy, for the detail. You clearly told us why the challenge, why you had to focus on that challenge. And then maybe just when you're writing the actions, the specific actions be as specific as possible, and then always keep in mind that who is going to be involved, what is it going to take, when is it going to happen, and how is it going to take place. So if you keep asking yourself those questions, then you'll be able to put down all the information that is necessary for your project to be complete. So right now I'm going to, and thank you once again, Mercy, and I wish you the best with the writing up or the completion of your project.
Okay, thank you very much.
Okay, so right now I'm going to ask Tijani Babagana. I had to, unfortunately, I muted you earlier on, but please, if you can unmute yourself now and share with us your question once again. So good evening to you, Tijani.
How are you, ma?
Fine, thank you.
Thank you.
Just tell us who you are, where you're joining from.
I, Baba Gana Tijani from Yobe State. I head promoter officer from Machang, Yobe State.
Okay, so what was your question? My
question is, we are here, we are engaging, we are joined to this link before, so I too engage. That is why I'm very appreciated to, he support me a lot of my skills. My question is, we are talking about the community engagement. We have the traditional institution, we have the religious leader, where challenges in our areas, the only is the causing intensify for their sustainability of this thing, for their creating awareness. Hello?
Yes.
So we have some part of their leaflet of their creating awareness. So, we are supported from the Northeast Development Commission, and they are serving 1 million lives in the Yobe State. And there are some marks and hand sanitizer. We go through their traditional institution. You know, we have a ranking from the district head to the village head to the community and so on.
Okay, so you're actually sharing with us what you are carrying out in your community as far as sensitization of the communities involved, and you say you reach out to the traditional leaders using respecting their traditions and their customs, and you also make available masks and hand sanitizer. Is that it?
Yes.
And if I may ask you, how has that helped you? Have you been able to see some result as far as vaccination is concerned and visiting of health facilities is concerned?
Yes. It's, we have the good progress. So, you know, we try to avoid the panic for not visiting the health facility. We have some previous months, we have low coverage in the routine immunization, but now we are progressing our activities, day-to-day activities.
Okay.
Yeah.
That's great. Thank you. So how far have you gone with the project?
So we are on process now.
Have you written down your project?
No, we are on process. We are not really writing it. We are not really writing it now. We are on process. We are going through, inshallah. We try to read it.
Okay, the deadline for submitting of the project is on Friday this week on peer grade.
Okay, ma'am. Okay, thank you.
All right, so wish you all the best.
Yeah, thank you.
Thank you too.
Yeah.
All right, so I'm seeing the raised hand. There's Joseph Gugi that's been raising their hand. And now I have 3 raised hands. Unfortunately, will not be able to take all of you today. So I'll take Joseph Gugi because he was the first to have raised his hand. And then Ada Khan and Florence Kanuli, please, let's make it a date tomorrow. I know I also have a date tomorrow for presentation with Dr. Tanushri. So Dr. Tanushri, Ada and Florence, please make it a date with us tomorrow. And we'll be glad to have you share your project. Okay, so Joseph, over to you.
Okay, hello, good evening, good morning. I'm Joseph Goge from Kenya, Muranga. I was asking, Masa, in this community engagement, is it possible to use IT, information technology tools, like when you have the community readers or opinion readers, can we use their groups, the groups they have? Like a church, they have WhatsApp group, Telegrams. Can these opinion readers be around to use these groups? Using IT, like sending messages, sending pictures, or if...
I think that's an excellent question, Joseph. And I'm going to ask you a question. What kind of information do they share in their WhatsApp group?
Like they can share the immunization is available.
Mm-hmm.
The immunization is available, the time, if it is the days, and who give the immunization, the PPI are available,
Mm-hmm.
and they exchange now the ideas, what they have.
Yeah,
All
so
the
I think, yeah, so I think it's actually, that's an opportunity. The platform is an opportunity for you. So you should be able to capitalize and use it to share. And the use of IT, you know, whatever we are doing, even our project, we are supposed to be contextual. So if IT is highly used to pass across information in our context, you know, then you can go ahead and do so. We know we are in the technology age. People, most often now in some communities, people don't listen to the radio anymore. So maybe your community radio will not be as useful as the WhatsApp platform. So you just have to judge your context and see how useful, who are the members of the WhatsApp platform? What is their sphere of influence? If you know that you share information on that platform to a community leader that is maybe in a community that's highly populated, and that he'll be able to transmit the information to the women in his community, then I think it's a good initiative.
Okay, thank you.
Thank you too. I don't know if Shalini, you had something to add to that.
No, I think, Charlotte, you summed it up pretty well. And the only question I have for Joseph is, have you started writing up your project? And so what is your priority challenge? Have you thought of that?
Yeah, I've started my project.
Yes.
And my priority is use of information technology tools and skills in immunization.
That would be your goal, but what is your challenge? Your challenge is to, from what I understand, is to reach out to the community to increase the uptake of immunization. Is that correct?
Yes.
Right. So what you can do is, first, like you described what you're thinking of, you can set your goal, and then you can work around and think about what is the biggest challenge. But actually what you should think about is, all right, this is my goal and these are my challenges, and this is how I'm going to design actions which are measurable, tangible, and they have a timeline and they have an outcome in a short duration so that you can achieve your goal, right? And then the other things that you need to think about while you're writing your project is also about who, what, where, when, how. As in, if you start defining who is going to do this, how is it going to be done? Do you need resources? Do you need approvals? Who are the community leaders or traditional leaders that you're going to reach out to? Is there a given time, or are you going to give appointments for the vaccination because you want to maintain social distancing and ensure that people don't contract corona, and so on and so forth? So these are a few things that I would suggest that you think about while you're penning down your project. Thank you. Thank you, Charlotte. Thank you, Joseph.
All right, thank you, Shalini. Thank you, Joseph. Joseph, I hope you're satisfied now.
Yeah, I'm satisfied. Thank you.
All right, thank you very much. And I wish you the best with your project. Okay, so it's 6:49 p.m. Geneva time. And I think we have listened to some very interesting and very enriching experiences this evening. And I want to thank all those who have been here to share with us. I want to thank Hanatu, Mercy, Tijani, and finally Joseph. And I also want to thank all those who have typed in contributions on the chat. And just to remind you, if you're having any technical problems, the technical support session with Dr. Alemble Statinku is scheduled every day from Tuesday to Friday at 11 a.m. Geneva time. So do well to join those sessions. You will find all the help you need. Also, I'll encourage you to watch the video tutorials on the Learning.Foundation platform. They are very useful. If you just focus on those tutorials and follow the guidance step by step, you won't have much trouble going through the exercise. And also, you have Telegram, the platform, the Peer Hub platform on Telegram, as well as your country groups on Telegram. The first layer of support is a country group. So if you have a problem, you ask a question there. And then, we know in every activity, in all of our activities, you are at the center of every action. So all the help you need is available for you. We don't want you to suffer in silence. And I hope you'll take the appointment with us tomorrow, 6 p.m. Geneva time. And I'll remember tomorrow that Florence has to be able to present. I also remember that we'll be taking Dr. Tanishri, and then there was one other person. So we do hope that tomorrow you're all going to be there so that you get to share your experiences with us. All right, so thank you once again for being with us today. And I'm going to invite Shalini to say the closing remarks, close the session for today. So until tomorrow, stay COVID safe and good luck with your projects. Okay, Shalini, thank you too.
Thank you very much, everyone. It was a great session, and thank you so much, Charlotte, for always making these sessions so useful and so wonderful. And we hope you all progress well with your projects. Stay safe and stay well. And until tomorrow, I would like to say goodbye from the Scholar team. Have a great day. Bye for now.
Bye, everyone. And looking forward to seeing you tomorrow. Good night, Shalini.
Good night and goodbye. Bye. Thank you.
Thank you for the opportunity.
And thank you to Anatu. You were wonderful.
Thank you.